It's very difficult when somebody is resident to accept an outsider, whether the outsider is to mow the lawn or to do the laundry or grocery shopping, or to even come in and live, whether it's a couple of hours a day, a couple of hours a week, 24/7, whatever the scenario is, any change needs to be discussed and considered from the senior's point of view. So you start the conversation by saying what some of the alternatives are, what you as the caregiver can't do any longer for them, because sometimes the senior is so wrapped up with their own needs that it's not that they forget about you, but their needs are taking all of their energies at that particular moment. So it's a way of doing a reality check. You discuss all the things that need to get done, whether it's cleaning out the refrigerator, grocery shopping, taking somebody to medical appointments, all of those things. You discuss the different things and just say, from a caregiver standpoint, you can no longer do X, Y, and Z. And sometimes it's better to write it all out so the senior has a chance to hear what you have to say and then visually understand that the needs that they have are really starting to mount. And once they understand that this is really a two-way street, it's not all about them, but it's about you and how your family might be affected or your job may be affected, they usually come around. And it's always a discussion, always adult to adult discussion. And once you state what the different needs are and who will fulfill it, whether it'll be one person to do transportation and somebody else to do whatever the other chores may be, or getting somebody in full time, as long as it's discussed, as long as it's very clear to the senior what their needs now are, because if you keep filling their needs, they're not aware of the impact it's having on you. The other part of that is, if you are going to bring somebody into the house, especially somebody who's going to be coming in on an ongoing basis, whether it's a couple of days a week or 24/7, the senior, if that person is at all capable, should be part of the discussion, part of the choices. And I always start out with, what kind of person do you want to have in here? Do you want a smoker? Do you want a non-smoker? Do you want somebody who can drive a car? Do you want somebody who deals with X, Y, and Z issues that are important to that particular senior? And once you have an idea of what you're looking for, you can't just grab the first warm body that comes in the door. You try to have a match for your senior if and when possible, and do all the background checks that are necessary, because this person is now coming into your home. They may have a key to your home, and you want to know that your senior is safe at all times. So you discuss all of these things. Most seniors come around when they realize that their needs are changing, but their choice is still to stay in their home. And most of the time they will work with you very cooperatively once they understand how many parameters are involved.